A lot of people think they have gained fat when what they have really gained is water. You are not necessarily getting bigger. You might just be holding fluid in the wrong place. And in as little as 7 days, you can reset that. If you understand the two hormones that are running the show, spoiler, drinking too little water makes you retain more. Yes, really. In this video, we will break down why you bloat, how ADH and aldosterone actually work, and a 7-day protocol that can help you clear excess retention. We will cover where retention actually sits in your body, why drinking too little makes you hold more fluid, why cutting salt to zero can backfire, and how to maintain stable hydration and sodium so you do not bounce back. One important caveat: this is not something you do every week. Your body will stop cooperating if you abuse it. First, the basics: retention versus fat. Water retention means extra fluid stored in a layer called the interstitium, the space between your skin and your muscle. That is also where you store fat. When you lose fat, you shrink that layer. When you have a lot of retention, that layer is full of water and you look puffy. Some people manage to lose fat but still look soft because the retention is still there. Others could look much more defined if they dropped the retention even without losing more fat. Because life was not confusing enough, your body invented two different ways to look bigger. So why do you retain water? Two hormones matter most. Number 1, ADH, antidiuretic hormone, also known as vasopressin. Your body is mostly water. If you get dehydrated, you are in trouble, so your brain, specifically the hypothalamus, produces ADH. When your fluid levels drop, ADH tells your kidneys to hold on to water. You pee less. You retain more. That fluid does not magically go into your muscles where it would look good. It goes into the interstitium. You look bloated, so the less you drink, the more your body holds on to every drop. So the solution to holding too much water is more water. Your body is trolling you. Stay well hydrated and ADH stays lower. You excrete more normally and retention goes down. Number 2, aldosterone. Aldosterone is a hormone that helps balance your electrolytes, mainly sodium and potassium. When your sodium levels get low, your body releases more aldosterone. Aldosterone then tells your kidneys to hold on to sodium. And when you hold sodium, you hold water. So if you cut salt to zero thinking that will fix bloating, your body says no. Cut salt to zero and your body will thank you by raising aldosterone and retaining more fluid. Yes, really. High potassium can also push aldosterone up and increase retention. So the takeaway: you need enough salt, not a ton, not zero. A common recommendation for adequate sodium intake is in the range of 4 to 7 grams of salt per day. If you eat a lot of vegetables and fruits, you probably do not need to pile on potassium supplements. That can backfire. And if you use light salt, a blend of sodium and potassium chloride, you can sometimes use a bit more total salt volume while keeping balance. Some people use around 8 to 9 grams of that blend. The goal is balance, not punishment, for everyday maintenance. Drink enough water. A general guideline is often 30 to 50 milliliters per kilogram of body weight per day, depending on activity and climate. Keep salt in the 4 to 7 gram range unless you use a balanced light salt approach. And go easy on heavily seasoned or super salty foods, so you are not constantly spiking sodium. Now the 7-day reset. This is a short-term protocol to suppress ADH and work with aldosterone so your body dumps the extra interstitial fluid. It is not a diet, it is a hormonal reset. Some athletes use similar ideas before competition, but they often cut water and salt at the end. We are not doing that. We are ramping up water, then bringing it and salt back to normal so your body stabilizes without the rebound that comes from extreme cutting. Here is the outline. Day 1, Sunday. 6 liters of water and 7 grams of salt, Monday. 8 liters of water, 6 grams of salt, Tuesday. 9 liters of water, 5 grams of salt, Wednesday. 10 liters of water, 4 grams of salt, Thursday. 11 liters of water, 4 grams of salt, Friday. 8 liters of water, 4 grams of salt, Saturday. Back to your normal intake, around 4 to 5 liters of water and 4 to 7 grams of salt. By Saturday and Sunday, you should see a noticeable drop in retention. You are not cutting water or salt to zero. You are resetting and then returning to a stable level. No, you do not do this every week. Your hormones are not stupid. If you keep shocking them, they will stop playing along. Use this as a one-off or rare reset. For example, after a vacation, a week of eating off plan, or a period on medication that made you retain after that. Maintain steady hydration and sodium so you do not slide back into constant retention. If you do the protocol too often, your body adapts and the same trick may stop working as well, or you may feel pushed toward more extreme measures. Your hormones have a memory. Do not abuse it. So to sum up, retention is often water in the wrong place, driven by ADH and aldosterone. Drink enough water and eat enough, but not excess salt, for a dramatic short-term reset. The 7-day protocol can work once in a while. Then keep things stable. And if you have heart failure, kidney disease, or you are on diuretics, do not change your fluid or salt intake without talking to your doctor first. Now go drink some water. Seriously, this video is for educational purposes only. It is not medical advice and does not replace a conversation with your doctor or a qualified healthcare provider. If you have heart disease, kidney disease, or take diuretics or other medications that affect fluid balance, speak with your physician before changing how much water or sodium you consume. Individual needs vary. Take care of yourself and use this information wisely.